Okay, first we're going to do an auricular inspection, palpatory and visual inspection in this segment here. First thing we're going to look at is the antihelix, and we're going to massage the ear so that everything comes to show here. So we can really start to begin to see things at C2 through C7. Right here around C3, 4 actually, maybe up into 5, there's some irregularity. Not horrible, but some things going on. There's no disc protrusion, it feels very smooth, but there is some irregularity, especially in the muscle off the side. And actually the spine looks relatively smooth until we get to the lower thoracic, where we can see some protrusion here, right along the spinal aspect of the antihelix. And then we start to see some protrusion again, and then in the lumbar area, around lumbar 3, 4, 5, we see a cord and some more inflammation off to the side. So wherever on the spine of the antihelix is smooth, then generally everything should be fine in the spine there, but where we see irregularity, those are older and more profound injuries. This is probably the biggest, L4-5 area. Also, we see something over here, and this is sciatic. And again, it's old as well, so it may come and go or not be of an issue at the moment. And here's a protrusion in the knee. That's also, you can tell why this is white. It's an older injury. And here we can also see more protrusion. This is all along the leg. And the hip. This is the hip. Protrusion. Okay. Other than that, back into the abdominal cavity. Symboconchum. Prostate area looks fine. Or I should say it looks relatively sharp. Sharp is a good thing. Not too much rounded off there. This is good. And then on back here, we start to see a little issue here in the liver. And I don't know if the camera can catch that, but we have a little bit of a press mark issue. There's a little bit of fattiness there. And here's the most obvious one, and interesting with this particular patient. Doesn't usually have this issue, but today we can see the protrusion here through the clear brain line. This is forehead and actually all through the headache area, primarily forehead, so we consider, and him in particular that we've already discussed, a sinus. And temple. This is into the temple too, so it's a pretty big area. Very profound protrusion. And looking through the lobe, everything looks relatively normal in terms of no major grooves. Just starting to develop a groove here, but this is going to probably take years to develop. But we can just see it starting to come up. This would be 45 degrees, so that would be tinnitus and or loss of hearing. But you know, he's sustaining it. So checking the back for a congenital issue, we're looking for protrusion, a continual protrusion for gallbladder, which we don't see, and also for duodenum, which is clear. Okay. So there we have a general look at the visual aspect of the ear, mainly looking at the spine, lumbosacral area, on into the cervicals, and we're noticing the obvious, the headache. So that's the first thing. Not to mention we saw a little bit irregularity there with the liver, and certainly this warrants us to move forward to test some of the things that we can't see, which we will do with a continuity test or Ohm's resistance test. So